Welcome to the PoultryDoc.com and the Poultry Doc Podcast. I'm your host, Dr. Blaine Moseshek, a board-certified poultry veterinarian, educator, and backyard chicken enthusiast. And my goal is to bring you science-based, fact-driven medicine. And also along the way, we're going to have special guests to speak about some of their issues and bring questions to the table. We'd love it if you subscribe and like the channel. And if you have any comments or questions, please feel free to submit them. And thank you for joining. So this is Maggie Carter. We're out at her home today, visiting her flock. We're going to talk about some recent issues with fowl pox that she's having. Here in Austin, we've had a significant amount of rain in the past couple weeks, and we're starting to see the consequences of that with birds breaking with fowl pox. As we'll talk about here in a second, mosquitoes are really the primary vector to transmit that disease, and again, we're seeing that today. So Maggie, tell us a little bit about what you have here, how long you've been doing this, what's been going on?
I've had my chickens for about two and a half years, and started with rescues and then raised the rest of them from chicks. And I had been in town working and coming home at night, but not letting them out. Let the flock out on Friday night and noticed one of them had some crustaceans over her eyes, and had no idea what that was. And it has gotten progressively worse. I contacted the group on Facebook, and then I saw your stuff on Facebook and thought, I need to get her to a vet. Everybody keeps saying it's going to be okay, but I need reassurance. Right. Because I'm really worried about her.
Yeah. Well, we'll take a look at the birds and see what we can find and discuss what's going on.
Okay.
So obviously she's sick and she has pox, and it's a virus, and there's not a lot we can do with it. What we're mainly focused on is supportive care and making sure that the wounds stay clean. And in her case, you can see it better, she's got a significant amount of lesions around the eye. Her right eye is to the extent where she can't see out of it anymore. And there's a little bit of exudate coming from the eye there. One of the things Maggie has, and you may have around the house, are maybe leftover eye drops, like prescription eye drops, antibiotic eye drops, for example. That the active ingredient there is the same, and those eye drops are pH balanced, so they don't irritate the eye, and they're really made for the eye. That's one thing that separates those antibiotic eye applications different than other antibiotics, is that they're pH balanced. So having those in there helps just to prevent, if there's not an infection there, it'll keep it from happening. And then we talked about chlorhexidine is another good topical cleaning agent that again is not bad for the skin. You can find there's some products out there that are a little bit more harsh than others, and Chlorhex is just like a pre-surgical scrub, so that's a good one as well. You can see she's got a few bugs around the eye, but that's, again, that's going to happen. We want to try to limit those with keeping it clean. That'll do that as well. Okay. So, yeah, Chlorhex. If you've got some other, like a betadine type scrub, that may work too. Probably not around the eye, around the face. If she's got some leg wounds here, if those were more open, we could use that.
Do I want to do that anyway, just to keep
these actually look good. It looks like they're regressing. It looks like they're healing. So I'm not too concerned with those. It's really the eye in her case that becomes the issue. Wet pox is another concern that we would have with fowl pox infection. So right now, this is what we call dry pox, and which means all the lesions are really on the surface, on like cutaneous surfaces or the skin. Wet pox affects the mucosal surfaces, so like the inside of her mouth and potentially down into the esophagus. Okay. The issue there is that they can grow. I mean, you can see the significance of the lesions around her eye now. If you can imagine those in her mouth, the issue becomes it obstructs her airway and she can't breathe. If she has another, like, flock mate, like it sounds like her sister, birds don't like to be by themselves.
I know.
Right? So that's stressful in itself. It's one thing if you've got birds that are aggressive and trying to attack her, or just what those kind of flock animals will tend to do is push away or try to get rid of the ones that are weak, because it draws attention. But in this case, her being by herself, if she's got a sister that they like to be together and is not aggressive, keeping something with her, or keeping another little flock mate next to her, will kind of help reduce that stress and keep.
I might put her sister in there then, since she's got the stuff too.
Yeah, and I don't know if you read, but the post I put on the Facebook page was about using iodine.
Tell me about that.
So you can go to Walgreens or CVS, and the most common one that I've found is a 10% iodine solution. Okay. And so it's used as a scrub, right? So if you've got It's used pre-surgical scrub. It's used in a couple different ways, but iodine is a great antibacterial, antiviral. And the way it works is it's not harmful, so birds or people can ingest it. It's not a big deal. Now you don't want to take too much of it, but the suggestion would be about a drop or two per gallon of water.
Okay.
And so it'll barely stain it, like a light tea colored is kind of the color you're looking for. And what that's going to do is if she's drinking or if we've got other birds that maybe haven't been affected yet, there's a potential there for that water to become contaminated. And by applying that iodine to the water, it'll make sure that we're killing those potential viruses that get into the water, and then she could potentially ingest those, and that's where we worry about getting wet pox in when she ingests it. So that's one. And iodine works for a lot of others. If we've got laryngotracheitis or LT, I don't know if you're familiar with that one, but that's a really good one to help kind of slow it because that one can really pass in the water easily.
Okay.
But
what about adding the iodine when you have electrolytes in the water? Is that all right? Or do
I
need
would
to
not
do
add the
separate?
two together.
Okay.
And I know there's a lot of use of electrolytes. You get on the forums and everybody's talking about electrolytes like they're, magical. I would, they're salt, right? So if the bird's drinking too much or ingesting those too much, they're relatively easy to get rid of. So she'll just pee them out basically. But they will help. But most feeds today are really well balanced. It depends on what you're feeding. If you're just feeding like scratch grains, then she would need some sort of supplement. But in this case, I know you're feeding pelleted feed. I saw it in there. So a very good balanced diet will cover most of those electrolytes.
Okay.
Not going to hurt you, but it's also probably not going to be, a panacea, right? So,
Because it is very popular.
yeah. It seems like, and sadly, this is one of the things we're trying to address with the site, the poultrydoc.com, is to bring access to you and everybody else with backyard chickens because, in case like this isn't a bacterial issue, but there are medications out there. The vaccines, we mentioned the difficulty in getting vaccines. We'll talk about in a second, but just getting you products or access to products. And so what the website's being set up to do is provide, you'll have the ability to come in and take pictures of her and give a flock history and kind of work your way through a diagnostic agent that will help you. So it's really virtual. So you go in, enter her information, enter what the issue is, and it'll walk you through 5 or 6 questions and questions about what's going on. And then it'll come back with a list of rule outs, right? So you'll have like 3 potential issues that it may be with a likelihood, like a percentage likelihood of each one. And then what that does will allow you, then you have the option to follow up with a diagnostic if it's needed for, like let's say if it was mycoplasma, there's a pretty simple diagnostic we can do, which is basically a mouth swab. And then once I get confirmation of that, as a vet, it's important for us to establish a VCPR, veterinary client patient relationship. And in some places we can do that virtually. Some states, veterinary medicine is regulated by state. It's not a national thing. So different states have different laws. In Texas, a true virtual consultation isn't enough to establish that. So I actually need to come out here in person. I've done it now, so it would work.
Okay.
But in those states where it's 100% legal for the veterinary medicine VCPR, you could have access to prescriptions and other things that you needed to prevent disease. And so, having access to medicines is one, but also having better access to the vaccines that you're looking for now, right? So those should be pretty easy to come by. Commercially, they're available.
And having access to someone who's trained that can guide us of when do I need to go to the vet?
Right.
Or can I take care of this at home?
Right.
Because being new at this, I don't know when I need to go to the vet.
Yeah, and that's one of the things I want to make available is there'll be that part of the app where if you don't need a diagnostic or if you don't need, a true veterinary care, but it's more at-home wound care in this case, we'll provide you with the tools and the guidance to do all that on your own. So
That's really good because this is very scary looking. And
it is, and I mean it's obviously it looks painful and it's not pretty and I know you worry and tons of other people are having similar issues, especially in this area. We talked about with all the rain. So
it's been bad.
The rain is good, but not the things that come with it.
Correct.
Let's talk about the vaccination a little bit. So, I'm not exactly sure what's available from the feed store in terms of pox vaccine, but I can tell you the one that's effective. We typically give it twice, so at around 10 to 12 weeks of age, and then again around 18 weeks, right before
Okay.
they kind of start going into egg production. But if you're familiar, if you're of the age, like my parents had the smallpox vaccination, do you remember, on your shoulder? And so you'll see, or that was a polio vaccination, but you'll see it leaves like a scar, right? So it actually forms pox.
Is it a live vaccine?
It is a live vaccine.
Okay.
So it's actually going to produce pox lesions.
Okay.
But what it is, it's like a little wing web. They call it a stabber. It's a terrible name in this case.
He showed me that.
Okay, so I know which one he's talking about
Okay.
now, or the type that he's talking about. So yeah, it's these birds are feathered, but like the web of the wing, right? So if we're all looking at a chicken, it's probably easier. Turn it on. Oh, sweetie, come on. Hang on, I'll just keep her straight up and down. We all know what a wing web looks like. So what that vaccine is, it's a live attenuated virus, and you'll get they call it a wing web stabber, and it's more like a little prick. Yeah, so it has 2 prongs. Each one is basically like an upside down sewing needle with a little port in it. And so the goal of that is to, when you dip it into the vaccine, the actual vaccine kind of fills those little holes, which would be the loop of the needle, right? And so in that case, they're sharpened on each end, and it's 1 prick through the center of the wing web. And what that does is when you go through, you deposit that vaccine into that little open wound now.
Okay.
And so over the course of about, if you look 7 days later, she's going to have little mild pox lesions around there. Okay. And that's totally normal. That reaction's normal. And she will get over it. She shouldn't have lesions anywhere else. It really will just be isolated to the wing web. And that's a lifelong immunity for the most part.
Okay.
So once she's vaccinated, especially if she gets 2, you'll notice that reaction on the first one and likely not on the second one.
Okay.
Because she's already developed immunity, and that second booster just gives her a little extra immunity.
Is it true that once they've had pox that they don't get them again?
Yeah, so she should have lifelong immunity, especially like a natural infection like this.
Okay.
She should not. I mean, there are things that could happen, like suppressed immune system or whatnot. Marek's is one thing that can do that. We can see other things come on from Marek's disease, but she would likely not have an issue with pox again.
Okay.
And so we can see now she's a little more calm. But with birds that are well feathered and older, you may need to just pluck a few feathers or wet these down.
Okay.
So that when you go in with the stabber, that the feathers don't wipe off the vaccine. Right?
Gotcha.
And some of them have dye. It allows you to see, once that dye's there, it kind of leaves like a little tattoo mark. It's not permanent, but it allows you to see that it was actually on the skin.
Okay.
So, yeah, but outside of that, I mean, that's really the one way we're going to protect birds. There's some obvious things, if obviously mosquitoes carry it, they're the vector for the virus, and it's hard to keep mosquitoes down, but that's one thing we try to do, right? Eliminate standing water, the things that everybody does or should be doing to eliminate mosquitoes or reduce them. Well, let's go look at the other one. But again, the lesions will typically last from 3 to 4 weeks, and then, at that end point, they'll regress back, and basically the scabs will fall off, and she'll likely have scars left from it. Now, hopefully they don't impede her vision or ability to see. What we want to do, though, obviously clean the wound like we discussed, make sure she's eating. We talked about that yesterday. And then drinking. Really, drinking is most important, right? Because we want to keep her hydrated and not losing weight. So she's thin, a little thin. I don't know what her normal conformation is, but birds' metabolism is super high, and once they come off feed, they lose weight really, really quickly. So we want to make sure she stays eating, obviously stays drinking.
She's eating and she's drinking. I sit with her a couple times a day to make sure, because I worry that she can't see, she can't find her food or her water.
Yeah. Yeah, and then, what you're already doing, isolating her from the others just to keep the stress down.
I was concerned that she was the culprit because she had a spot, but she does not seem to have anything else.
I mean, maybe like a few like tiny little spots. Now, that could be just her, and you would know better than me, but it's also she could have been like mildly exposed in the past, and so your other birds as well too, right? So there may be some immunity that you already have in the flock, and so it doesn't necessarily mean, so she's got it, doesn't necessarily mean that everybody's going to get it. Obviously we've got more than one that has it now, but your older birds, it's a good chance that they've probably already seen it.
So this is her sister. If you want to hold her.
Yeah. So what we see here is like just an earlier presentation, right? So she's just probably starting to develop this. You said it came on it wasn't there yesterday.
I don't remember seeing it yesterday.
Yeah.
I check them every day.
Yeah, and so you can see how fast they develop, right? Even if it was just like a little spot yesterday, you're in here often enough and looking at them very closely so you know what's normal and what's not. And so the lesions can come on quickly and they can develop really fast. Again, I don't see it around her eye, maybe a little spot there. Now, she could, it could progress. It could get further around her eyes, and we're going to do the same things that we did with your other girl about trying to prevent it and clean it as it grows, if it does. Let's hope not. But
And it's okay for them to be together.
yeah, again, the mosquitoes are the primary vector of it. So
Okay, I'll probably stick her with her sister then.
yeah, and like we mentioned too, right? Having the two together is when birds of a feather flock together. It's the saying. So they kind of they would like to have somebody with them. They don't like to be alone.
And viruses get enhanced with stress.
That's right, yeah. So stress causes their immune system to be suppressed, and what we're trying to do is keep them healthy and stress-free and as strong as possible, right? Eating and drinking are main things. We just want supportive care gets them through this one.
Okay.
Okay.
Good.
And she looks bright and alert.
She can hear.
There.
I hear y'all talking. Come here, I'm going to feed her and then I'll put her up.
Well, Maggie, I really appreciate you showing us around today, and hopefully you got a little bit took something away from our discussion on pox and what it is, how it's transmitted, how to prevent it in the future, and we hope to bring you some of those tools, more tools, especially like the vaccines in the future with thepoultrydoc.com. Do you have any other questions?
No, but thank you for all the information. It's very helpful.
Thank you. Well, that does it. And again, if you like the channel, subscribe, do all those things, and come see us for the next one. Thanks.
Thank you.